Good afternoon, everyone, and welcome to our first Lunch and Learn of 2022. Happy New Year to everyone. We are really excited to have you here this afternoon. Thank you for joining us. Before we get started with today's presentation, I just want to take the time to introduce myself and go over just a few logistics. My name is Judith Ruiz Branch, and I am the Director of External Affairs here at the Illinois Association of Medicaid Health Plans, also known as IMHIP. And as you can see, IMHIP utilizes the GoToWebinar platform for our webinars, so you should be seeing a control panel pop up either on the right or left-hand side of your screen. Just want to bring your attention to this. If you're logged into your computer, you will see it because this is going to be your sole means of communication throughout this next hour. I am coming up as IMHIP admin or IMHIP organizer. So if for any reason you need to chat with me or if any questions come up throughout the presentation, please feel free to put them in the chat box. I will be responding as we go along, but of course we will always keep time open at the end to answer any of your questions. And then as always, in our post-webinar email, we will be providing the slides from today's presentation. So if you are logged on via your phone, don't worry, you will get the slides afterwards. So without further ado, I want to welcome back our amazing CEO, Samantha Olds-Frey, from maternity leave. This is her first presentation after coming back, and we're so excited to have her here today to help us present on general billing and impact.
Thank you so much, and good afternoon, everybody. This is going to be a general overview. We're going to walk through resources that we have on our website and that HFS has on their website, but we also want to make sure that we leave time for Q&A after the presentation. So please do use that question box, send in, or the chat box, send in questions so that after I walk through the presentation, we can answer some direct questions that you all have. And as a reminder, you will get the slides and the recording of the webinar after today's presentation. So that'll be sent out to all registrants as well. And with that, we're going to dive right in. So who we are here at IMHIP, we are a trade organization, a member-based organization representing the full industry of Medicaid managed care plans in the state of Illinois. We work with the state government, with legislators, advocacy groups, and of course our provider community. And the goal is to help residents of Illinois live longer and healthier lives. But more specifically, who are the Medicaid health plans here in Illinois? So in the Health Choice program, we have 5 health plans: Aetna, Blue Cross, County Care, Meridian, and Molina. As you know, County Care operates within Cook County, and the other 4 operate statewide. One reminder is there's been a lot of transition in the Medicaid space over the past several years, is that Meridian is a Centene company, and that Aetna in Health Choice has members that were formerly enrolled under the name Illini Care. Then we, of course, have our MMAI program, which is our dual eligible. You must have full Medicaid and full Medicare to be enrolled in MMAI. We have 5 statewide programs and plans in the MMAI program. So that's Aetna, Blue Cross, Humana, Meridian, and Molina. All of these plans are statewide, serving dually eligible members. Again, full Medicare and full Medicaid to be enrolled in MMAI. And then last but not least, we have the Youth Care program, which is operated by Meridian, but the name will display as Youth Care, and that is for the DCFS involved children. So again, just a reminder, Illini Care Health membership used to be, or Aetna membership used to be enrolled in Illini Care, the name. So we're going to dive into our comprehensive billing guide. This is all on our website. We update it regularly. Please go ahead and take a look, download it, use it as a resource. If you have questions, suggestions, do feel free to send us those our way. We want it to be as user-friendly as possible. We are, to the best of our knowledge, one of the only states that has a comprehensive billing guide like what is on our website for all Medicaid health plans. Operating in the state, it is a comprehensive billing resource. We will say that by and large, the comprehensive billing guide focuses on the health choice population and the whole health choice contract. And the reasoning for that, of course, is that MMAI by and large is going to follow Medicare billing. And so the comprehensive billing guide is really focused on the unique structure of Illinois Medicaid and Medicaid health plans. Here are some various components of the comprehensive billing guide. So of course we have general claim submission, claim disposition, and then we go through various providers as well. We do have a document or a chart updating all the various updates that we've made throughout the time. So on the different versions, I believe we're on version 22 or 23 at this point. It's hard to recall, but we do document the various changes that have occurred since version 1, and you can find it on our website. And here we want to make sure, as I indicated, if you have questions, comments, recommendations on our billing guide, you can contact us. There's a place here to contact the health plan directly. If the question is for a specific health plan, it'll take you to the contact links for the various health plans that they've provided IMHIP. But if it is general feedback or questions on the billing guide itself, you can contact IMHIP directly. That link also works for any general across the board inquiry, whether it be about the roster or billing in general. If it's an industry-wide question, we will do our best to address it, and you can use that Contact IMHIP resource. As I stated, this comprehensive billing guide, it really focuses on health choice, the health choice program. And it is for contracted providers. And we want to underscore that because there are pieces around the health plans portals and other resources that are really based off of whether or not you're in network. And so as we go through all of this, please recognize that there may be variation if you are not a contracted provider. This again is focused on health choice. MMAI may follow different guidance, and the big area there is going to be Medicare. When Medicare is primary, Medicare rules for billing benefits, all of that is gonna take lead. And finally, we recognize that in this billing guide, there may be differences from traditional commercial practices. This has been developed in consultation with provider associations and with HFS technical support. Follow this billing guide. If you differ and you follow traditional commercial billing practices for Medicaid services that are outlined in this universal billing guide, you may run into billing challenges. And the reasoning for that is Medicaid, especially Medicaid in Illinois, has some unique requirements. We try to highlight all of those within the guide. We do recognize and we try to really flag it when it's going to be different than commercial billing practices. But it's important to underscore that the billing guide should serve as the source of truth there. One other item that I always just want to underscore when we're talking about commercial billing practices is the Medicaid MCOs are going to cover CPT and procedure codes that are on the HFS covers, that are covered benefit in the Medicaid program. If there are CPT codes or HCPCS codes that are not covered, that don't have an associated reimbursement rate, that are not listed on the HFS fee-for-service benefit or list, those claims are not going to reimburse may not reimburse in the manner that you anticipate, even if they reimburse on Medicare or on commercial. And again, that is because the Medicaid MCOs are implementing and covering the Medicaid benefit package. All right, so again, on the comprehensive billing guide, we update it regularly. Like I said, we have well over we're on our way to 24 versions at this point, but we do welcome your feedback and input. If there's something that's not clear, if there's something you want in addition to the comprehensive billing guide, if you want something reiterated, please let us know. Or if you've run into a common challenge and you think it would be helpful for other providers to have clarity on that challenge that you've run into, please let us know and we'll do our best to incorporate it in one of our upcoming versions. So impact, we hear about impact all of the time. It is critical with how you are reimbursed by a Medicaid health plan, is absolutely dependent upon how you are enrolled in impact. And impact is the Illinois Medicaid Program Advanced Cloud Technology. So what is impact? It is a web-based system. It replaced the Illinois Medicaid Managed Information System. Its provider enrollment was the first piece of that, and it went live back in 2015. But we're still talking about it today because it's critical in how you are reimbursed by a Medicaid health plan. And you will hear us as we talk about general billing and we talk about reimbursement, and we talk about various claims issues. It really all comes back to impact, as that is sort of the first foundational block on how you are loaded as a provider. All Medicaid providers seeking reimbursement from a Medicaid MCO must be enrolled in impact. This includes MMAI. So even if you only want to serve Medicare members enrolled in MMAI, you must be enrolled in impact. Medicaid MCOs are barred from contracting or listing in network providers that are not enrolled in impact. Impact serves as the credentialing agent for all Medicaid payers. And so this verbiage can get a little confusing because credentialing all happens for Medicaid at the impact level. The Medicaid plans do not credential providers for the Medicaid benefit. They do load providers, they do contract with providers, but they don't credential with providers. The other thing to remember, of course, is that enrolling in impact is simply the first step. It does not mean you are contracted with a Medicaid health plan. And then, of course, it also does not mean that you as a provider have to see Medicaid members. It is just the first step that if you're ever to be reimbursed by a Medicaid MCO or by fee-for-service, you must be enrolled in impact. So how do you register an impact? So again, we're just going to reiterate, it directly affects how a provider is reimbursed by a health plan. Every user must create a login account called a single sign-on account. You can do that through the Impact website, which is here. Please submit all applicable provider types and specialties. Taxonomy numbers and NPIs must match the ones listed on claims and rosters to ensure payment. And then multiple provider types need to register separately with separate and unique NPIs. And I'm going to underscore a few of these items throughout, but let's start with the multiple provider types and multiple registrations with unique NPIs. We've seen great improvement on this, and we saw this was a particular challenge in the behavioral health space if you were providing both DASA services and mental health services. The unique NPI and the unique registration ensures that when you submit a claim as a provider, that it is routed through the system correctly and that the code is reimbursed at the appropriate reimbursement level. When there are, and we do see this from time to time, that the same code may be reimbursed differently based off of the provider type. If the provider type is not easy for the coding systems to identify at the health plan level, reimbursement mistakes and claims processing mistakes can happen. So with that, it's really critical that there be unique NPIs and unique registrations to ensure that your claims are reimbursed properly. Because at the end of the day, 99.9% of claims processing is all done electronically. And so it's really systems and coding and relying on a computer to sort of understand the logic behind how a claim was submitted. And so if it's not really black or white, if it's not cut and dry and clear, the likelihood that it'll either be denied, rejected, or potentially reimbursed at a level different than what you're anticipating increases. The other item that I'm going to say over and over throughout this meeting or throughout this webinar is the critical requirement that your taxonomy number, that your NPI number, that the name you list as the provider, and that the Medicaid ID all match, that they match as they're registered in Impact, that they match as they're completed on the roster, and that they match as listed on the claim. I refer back to this often as how you buy something online. And when you buy something online and you're typing in your credit card number, your name, your credit card number, your CVV or the 3-digit code on the back of your card, and your zip code, they all have to match. It all has to align so that the credit card processing system can process your credit card and that you can make your purchase. The same is true for claims processing systems at the health plans. The claims processing system needs to align the provider name, their taxonomy number, the NPI, and the Medicaid ID, and identify everything across the board as matching and as an eligible provider for reimbursement, and eligible provider to provide the service that was provided. All of that has to align, and this is one of probably our most common mistake we see, is where there is a mismatch somewhere along the way. Either it's the wrong taxonomy number or the wrong NPI or the wrong name or the wrong Medicaid ID, but the system can't figure out which one is wrong. And so what ends up happening is a rejection or a denial. And those are things that can be fixed. We just need to align and make sure that they all are the right numbers for the right provider for the right service. It can be fixed. The provider reps are there to help you to do that, but it is a very common issue. So key terms when we think about Impact itself, there are various different types of ways you can register with Impact as a sole proprietor. This is, of course, a provider who owns their own practice. The billing provider, this is a provider who submits claims or receives payments for an individual provider rendering service. That is a provider that does not bill directly and who prescribes or refers services through a group or an FAO. An FAO is a facility agency organization, and that's, of course, an entity such as a hospital, nursing home, or lab. The billing agent, so this is just an entity that's just billing. They're not actually providing services, and they're not a provider. Think of that as either a software vendor or a clearinghouse. MCO plan, so that is, of course, the healthcare plans that provide healthcare services. Sister agencies may also be listed, and that is often, you're going to see that if it's for a waiver provider, state agency or waiver provider. New enrollment, a provider who needs to enroll in the Impact system. And then, of course, revalidation. A provider who is currently enrolled in the MMIS system is required to renew enrollment information at least every 5 years. And so I want to flag that as we're really, the importance of revalidating your information, and then, of course, updating licensure as appropriate. And this is becoming more and more critical as we continue to be in this public health emergency, and licensure timelines have been extended. So just want to remind the provider community of the requirement for revalidation at least every 5 years. And if there's an update before then, please update that in Impact as well. And then there's an application ID, and this is a system generated number which you may use as a provider to locate your application once you've submitted it or during the revalidation. And so get that application ID number, make sure you have that so that if you do have questions, if you have inquiries, when you email or call Impact, you have a number to reference what your inquiry is about. So again, every single user must create a login. That's called a single sign-on account. You can do it through the Impact website. There are 2 steps in creating a single sign-on, and one sign-on account can create multiple enrollments. There are different provider account profiles depending on how you want them to be used: domain administrator, provider enrollment access, or view only, depending on how the user would like to use those and what makes sense for your organization. How do you want to enroll in Impact? So first of all, you're going to want to collect the information necessary. There's a lot of information that needs to be collected. This is something you want to do on the front end rather than starting the application and then collecting it. You want to review enrollment and determination. So during this stage, you're going to have the authorized staff review the information, credential it, and then you will be submitting it. And once it's submitted, it cannot be updated. Providers need to complete the license recertification process and revalidation every 5 years. Impact items to keep in mind. First and foremost, department sends MCOs an impact file on a weekly basis. And then, of course, it may take an MCO a few days to a week to load the updated impact file. Why we want to flag that is there can be a lag between when you've received your notification that you've been approved and enrolled and when the MCO has that information. Now, it's not going to be a long time, though, because there are just a few lags. So, if you're approved, but the impact file has already been sent for that week, you're going to be on the next week. So that's 1 week lag. And then if it takes the MCO another week, that's a 2, potentially, depending on if you where the cutoff was, it might be 3 weeks. So if you have gone more than 3 weeks and you're still not showing as loaded on the impact file by a health plan, that is when you want to escalate and reach out to your provider rep or your other contact and see what you can do, see what's going on. And so then the plan can either reach out to HFS or we can start troubleshooting. So there may be a few weeks, but there shouldn't really be more than 3, really 4 if there are a lot of holidays involved. But it should be a fairly timely process once you've gotten that approval from Impact. If you are seeing claims issues across all health plans related to not being eligible or enrolled provider, there may be an issue with your Impact registration or with what's being sent over from the Impact file. And if you're seeing claims issues with just one plan, it may be a roster or loading issue. There are a lot of resources already on HFS's website. We just want to remind you of those and have them in a nice, easy to reach resource. The HFS provider handbooks, the provider enrollment page. They have a wonderful general questions email and a phone number, and then login issues and contact as well. This is all already on HFS's website. You will get this PowerPoint after the fact, and I just wanted to flag this for you. Contract and billing specific. So I'm going to just reiterate this. NPIs and TINs, and I'm going to add taxonomies on a claim. If they do not match, they are one of the most common denials Medicaid health plans see. Every claim must have the provider name, NPI, and TIN for health facility or health professional that provided the treatment of service. If you provide services under multiple provider types, you need unique NPIs and Medicaid registration for each provider type. Again, the reasoning for that is appropriate logic. All claims must include the 10-character specific provider taxonomy code. It has to be the right taxonomy code again on the claim. So if you have a general acute hospital taxonomy and a family practice taxonomy, obviously you need to be submitting the right taxonomy for the service that's being provided. They have to match the corresponding category of service and procedure code and or place of service. Hospitals with separate NPIs for professional categories of service and institutional categories of service must use the appropriate NPI that matches the corresponding Medicaid ID. So again, matching all pieces of that. The taxonomy has to match, the Medicaid ID has to match, the NPI has to match, and the TIN has to match. And it has to match the name that is listed. So where we see the names not matching often is using the professional, like the facility information with the individual doctor, or vice versa. So just making sure that they're all in alignment. It seems simple, but it is one of the most common mistakes we see on billing, and it's absolutely something you can correct as a provider and ensure that you're receiving appropriate and timely payment. But it is the most common mistake we see. Again, they will not process appropriately if things are not aligned and do not match. Basic claims requirements: all submitted claims must identify the name and appropriate TIN number of the health professional or facility that provided treatment, or with the matching NPI based off billing guidance. They have to, of course, identify the patient, RIN, and or the MCO specific plan ID. As a reminder, all Medicaid health plans are required to accept the RIN. So I think by and large, that's what the health plans are using, but there may be an MCO specific plan ID as well. Of course, their address and the date of birth of the member, the date and the place of service. And then, of course, any applicable prior authorization numbers provided by an MCO have a valid diagnosis, procedure, modifier, and location codes. And on that one, we want to make sure that the diagnosis codes are those that are listed on fee-for-service, that are a covered benefit by Medicaid program in Illinois. Of course, all diagnosis codes are to be filled out to their highest number of digits, 4th, 5th, and 6th character requirements, and 7th character extension requirements as appropriate. As a reminder, Medicaid is always the payer of last resort, so ensure all other insurance resources, Medicare, third-party coverage, etc., has been exhausted before submission, including coordination of benefit documentation with claim submission. And then, of course, the claim has to be certified by the provider that it is true and accurate, does not contain untrue, misleading, or deceptive information, and identifies each attending, referring, or prescribing physician, dentist, or other practitioner. One thing I will flag on this that we see as an often a billing error that we see often is that providers are billing an LTSS provider or health plan for a Medicare covered service. So if a member is enrolled in LTSS, it is a very limited benefit for long-term care, some transportation, some behavioral health, very, very small benefit. Definitely not, prescription drugs or hospital coverage or general primary care. That is all still covered. That member has coverage, but it's covered by fee-for-service Medicare. And so in that, we are seeing a lot of denials still in that space for LTSS members. And what we want to make sure providers know is it's denied by that health plan because it's not a covered benefit by that health plan. However, you can absolutely bill Medicare and receive reimbursement. So again, just making sure that you're not losing those resources and making sure you're getting reimbursed for the service you did provide, but just billing the appropriate payer. On all of on our billing guide, we have important steps for EDI claim submission for all of the health plans. So this is really helpful information. Cannot stress enough, electronic submission and signing up to receive electronic payment and remits, very, very helpful. Reducing paper reduces mistakes, confusion. Cannot recommend signing up for EDI claim submission and electronic fund transfers and electronic remits enough. Highly recommend all the providers do that. If you're having challenges still, don't worry. Reach out to your MCO provider rep. On our website, there are escalation documents. You can always come to IMHIP, your trade association, or the department to seek a resolution. But really what I want to stress with that is that we here at IMHIP and at the plans want to work with you. So if you're having a challenge, if you are having trouble just finding the right person to talk to, IMHIP is here to assist with that. But really the provider reps at the health plans are also there to assist for education and resources as well. So what are our resources? We have key contacts on our website along with escalation contacts. We have billing guides. We have the links to the provider manuals and prior authorization links. We do our best to regularly update and reflect any URL changes and document updates. And we of course have the universal roster on our website as well. We recommend and welcome any suggestions and additional resources that can be helpful to you. So if you take a look around our website and think, this other document could be helpful or clarification on this policy could be beneficial, please let us know. Several of the resources we have on our website came from the provider community asking for aggregation of resources. So here are some of the pieces of information on our website. Here's like the provider manual, so you see how they're listed. And here's something that is critical that I want to highlight, the key contacts for providers. So it is on our website based off topic area. But additionally, over here on the right-hand side, you'll see a report a contact change. If there is a individual listed and they're not the right person, they've left that health plan, and you know that, or you've emailed them and they're not responding to you, or you got a bounce back saying they're no longer at the organization, you can let us know and we work with that health plan to get that contact updated. So not only do you have that contact of who you should reach out to for dental, for example, at health plan A, but that others using the provider key contact list will also get that update. So this is there. We do have escalation contacts. We have contacts for care coordination versus billing versus contracting. We try our best to be a resource in terms of contact for the health plans. Also, if you just don't really know where to go and you want to contact IMHIP through the Contact IMHIP page, don't send PHI through there. Please always comply with HIPAA requirements around personal health information, always as a covered entity. But we will also help you navigate that as well and get that over to the right health plan and the right contact. To learn more, you can, we do have resources to learn more. One thing we recommend is subscribing to our quarterly newsletter so that you do get information that we send out. We have our video library on our website along with podcasts and articles and reports that you can find out about. And then of course, we do these monthly webinars, lunch and learn webinars on billing every month to ensure that we are doing our best to educate the providers and go through various billing challenges and opportunities that we see. Here is sort of our video library, things like telehealth, the roster. We have a roster webinar on there. One of the most common challenges, is just guidance on completing the roster. Additional resources also that HFS provides that we also link to on our website: program descriptions, transition letters, and client communication. Why I want to flag that is it's going to be particularly critical as we know that redeterminations will be turned back on in the coming months or year. And so when those letters are sent out, HFS does post those on their website so providers know what to expect. And then we just share the link on our website as well as a nice handy resource. Enrollment information is on HFS's website so you can understand, especially by county or region, the size of the Medicaid health plans and your service areas, care coordination, quality metrics. And we get asked about this from time to time. The health choice model contract is on HFS's website, so you can review that as well. And with that, I want to open it up to questions and answers. I wanted to make sure that we left enough time for those questions.
So Sam, did you want me to read them off to you?
Yes, I cannot see them.
No, perfect. It's fine. So Pamela is asking, how is IHA enforcing the Prior Authorization Reform Act, House Bill 711?
That is a wonderful question. So we are obviously going to comply with House Bill 711. It is a multifaceted bill, so it could probably be its own several webinars at once. But we're working directly with HFS to ensure that we are in compliance with House Bill 711 and the prior authorization requirements outlined in that bill. What I would recommend, Angela, if you want to email me, if you want to contact IMHIP directly with more specific questions, or if you have a specific area, I would be happy to dive into that further. But we are working with HFS on that and are aware of House Bill 711.
Great. Dawn is asking about revalidations and impact. It's her understanding that they're not currently required, and she wants to know, is this solely the MCO's requirement?
No. So for revalidation and impact, the provider needs to go revalidate every 5 years, and that's really, it's a requirement of impact, but I do believe it actually stems from federal requirements around provider enrollment in the Medicaid program. My understanding, although I'll be honest, I'm not a provider and I've not done this, is that the revalidation, if your information's correct and you've kept it updating, is a more straightforward process than the initial registration.
Okay. Let's see. And then Lisa is asking about community-based services. So for community-based services, primary insurance, including Medicare, doesn't cover staff, and doesn't cover, and the staff are not credentialed. So we are not required to bill primary for Medicaid. Why are we required to do so for the MCOs?
So on this, Lisa, the plans are following, just Medicaid being the payer of last resort. If there are instances where you aren't required to submit a denial or an EOB to fee-for-service Medicaid to be reimbursed, but you are required for the Medicaid MCOs, let us know what that is and we will research that. It is not the health plan's intention to be more restrictive or limited than fee-for-service. That being said, if there's something going on, it could be a misunderstanding. So what I would like to do on that, Lisa, and if you're not getting denials today, but then it might not be an issue. But if you are getting a denial from a health plan, as you should have billed a different payer, and you're not getting that denial from fee-for-service, then because we're requiring an EOB, then if you would give us the specifics, please email me that and we will dig into that further, because it is not meant to be, we're not trying to be more restrictive there. We're trying to follow HFS policy.
Okay.
And part of it may be that that we may just not have that benefit.
Okay. The next question is the MCO required to inform IHA on updated contacts?
So we work collaboratively with the hospital association. We share our contact information with the IHA. There's, obviously at the end of the day, the MCO's requirements, contractual requirements are to the state, and then of course to the provider, the network contracted providers. So that's where, it's contractual relationships or statutory relationships. I don't know of any requirement that we update IHA, the Illinois Hospital Association. However, we do work collaboratively with the IHA on a regular basis. We do want to make sure that the hospital community does have information on how to contact the plan. So if you're having an issue with a particular plan or contact and you just want that updated, do let us know and we will do our best to get that updated.
Okay, and Pramila is asking if you could just go over one more time about LTSS claims.
Yes, so this can be very confusing, but LTSS is a narrow benefit package. It stands for long-term supports and services. It is very limited in when members are enrolled in there. It's basically dual members who have Medicare and Medicaid who've opted out of MAI but have long-term support services, whether they live in a nursing home or they receive waiver care. When they're enrolled in LTSS, it's really it's the waiver care or the long-term care, some transportation, and some behavioral health. It's a very, very narrow benefit. What we often find is that LTSS members are having their claims, or providers are submitting claims for LTSS members to the Medicaid Managed Care Organization. And these claims are for things like a hospital stay. Well, the health plan does not have the hospital benefit within the LTSS package. They only have that very narrow benefit. So that claim is going to be denied, and it's going to be denied most often as a non-covered benefit. This can have hospitals or other providers sort of scratching their head because, of course, hospitalization is covered under Medicare. Why I pointed this out is it is still a covered benefit under Medicare. You just have to bill Medicare, not the LTSS provider or the LTSS MCO.
Okay.
I got this.
No, go ahead. Yep,
from John. I just see a lot of questions in 15 minutes, so I'm gonna do my best to work through these. So the roster and when is it needed? We are also one of the only states that has a standardized roster for all Medicaid health plans. It is required for loading Medicaid providers in the health plans. It is also required that the provider community utilize it via statute and that the MCOs accept it via statute. It is that requirement. It is needed. We recommend highly that it be sent on a monthly basis to the Medicaid health plans that you're contracted with, or at minimum, at least quarterly if you don't have updates. We recommend that you send the roster, the completed roster, at the same time that you enroll an impact, that you send in your application. The reason being is that the effective date of the roster is the latter of one of these three. It is one, when you are contracted with the health plan. So obviously, if you're not contracted, that's a different challenge. Two, when you've submitted the roster, and three, your impact effective date. So whichever one of those is last, that is going to be the effective date of that provider, of that roster. So we recommend that you send them in the roster and the impact registration simultaneously. I'm going to go to the next question. Oh, we already described that. Kim Woodside, I'm going to send you my email address. You're asking about our website and how to register. I just want to make sure I'm answering that correctly. What are the guidelines for prior authorizations for Med B and Med A? I'm going to assume that Med B and Med A, of course, are Medicare A and B. And so what I will say is prior authorization requirements vary by health plan. Please go ahead and look at their prior authorization links. Thank you, Robin, for pointing out, though, that it could vary from MMAI to Health Choice. So make sure you're looking at the right prior authorization list. If this was a question with regards to 711, which I don't know if it was or not, but House Bill 711, of course, is a state bill, and state law impacts state programs and impacts policies within the state of Illinois. We are not, of course, allowed to, at the state of Illinois, to tell the federal government or a federal program like Medicare how to, implement policy. So if this was about House Bill 711, I will say that House Bill 711 is limited to just Illinois products. So that's, and in this context, it's really the Medicaid benefit. It does not have a direct impact on Medicare. I got another question. Where's the impact IDs? Oh, if you've registered an impact and you want to do business with an MCO, proactively reach out to that MCO. We have contacts on our website. They also have it on their website. If you want to be a network with an MCO, please go ahead and reach out to that MCO for a contract to be in network. All right. So somebody asked about membership with IMHIP. So IMHIP, of course, always tries to be a resource regardless of membership enrollment. If you're enrolled with, if you're a trusted partner of IMHIP, you do get additional resources, but we try to be helpful regardless of that. But we do have information on our website for IMHIP's trusted partners. One thing that the trusted partners receive complimentary with enrollment and membership is they get all of the webinars, access to all of the webinars in a complimentary fashion, along with additional webinars and resources that we provide. I was told by Impact staff not required to be registered in Impact. So the one instance where this may be the case is if it's a provider that is providing services or rendering services, and they are always rendering services through the group, or they're practicing under a different, like a physician or something like that, and they're never going to show up on a claim and they're never going to show up on a directory. That may have been the case. That might have been what they were talking about, Dawn. But if that isn't it, and you want to provide more information, go ahead and follow up with us, and we will do our best. I'll do my best to sort of dig into that further. But if you're billing in Medicaid MCO for a Medicaid service and that provider is showing up on the claim, then they absolutely have to be registered in Impact in order to submit a claim. Maggie, great question. How will we know if there is an MCO list update? I think this is on the contact list. I think that, Maggie, your question is on contacts. We don't send out a notification of the update. So if you were the one telling us, hey, Susie no longer at Health Plan A, we'll try to proactively get that new contact over to you. But then we will just update the list, and we don't highlight that there's a new. We don't highlight the contact, because hopefully the people listed are the accurate ones. But if you were the one that initiated the change, then we proactively let you know. All right. We got a question from Eileen, and oh, what a tricky one you've got here. So for home health care, do you bill with an NPI or do you not? And there has been so much back and forth on this. And so I definitely understand your frustration. I'm going to point you to the comprehensive billing guide. And where this comes out and is the trickiest is a lot of home health care providers are also waiver providers. And so you guys may have been registered before, potentially with one HFS impact registration, or your home health care NPI was added onto your waiver NPI registration, or you may have done that. If you are submitting a claim for home health, not a waiver service, but for home health, you do require an NPI. If you are submitting a claim for waiver services, do not put an NPI on that claim. However, make sure you're using the appropriate Medicaid ID for the service you're providing. And so what I mean by that, and NPI and taxonomy and everything else. So if you are submitting a claim for home health care, make sure it's a Medicaid ID registered for home health. It's an NPI that is registered with that Medicaid ID. It's a taxonomy number that is registered with that ID, associated, affiliated with that ID, and it's for home health. And then the name and all of that. For your waiver provider services, you're only going to use, your taxonomy and your Medicaid ID. You will not use an NPI. That's really tricky. We've done our best to spell that out in the waiver guidance and the home health guidance, but it is a challenge. So if you're having further challenges on that, do feel free to reach out and we will do our best to navigate that, or to help you navigate that and get you some educational resources. Max, you've sent a wonderful question about where in impact may I see the expiration date of our file. You've revalidated, but you are still getting errors with billing. Let's take this offline, as it might, I want to sort of understand more of the challenges you are seeing. Is it with all plans or is it just with one? And I may just need to connect you with the impact team to see what's going on with your registration. It could also be a licensure issue. There's just a little bit more that we need to dig into there to see what is going on. Oh, I apologize, Carmen. I think I spoke a little unclearly. When you register an impact, you don't have to put information about the MCO plans. HFS sends the file over to the plans of what is registered in impact. And so I do believe you can select the plans that you're in network with in your registration. I do think that's an option, but the health plans receive the full impact file. And on that, you as a provider, you don't have to do anything other than register an impact. That's something that really happens behind the scenes. Robin, thank you for clarifying your inquiry. It was on skilled facility. So for a skilled facility, prior authorization, it's going to follow the same Medicare A, so Medicare A and Medicare B rules it'll just depend on who's the payer, who's responsible. Is it a Medicare benefit, then it's going to follow the Medicare requirements. If it's a Medicaid benefit, it'll follow the Medicaid requirements. For LTSS, skilled care, that Medicare skilled care falls to Medicare fee-for-service. It does not fall to the LTSS benefit. I hope that is answering your question. If not, email me and we will send out my email address as well, but email me and I will try my best to follow up. Oh, Maggie followed up of if it's been unsuccessfully loaded, the impact file or the list, how will you know about that? I believe is the question. Yes, you will, oftentimes it's going to be the portal that their provider portal that they may have. Or it might be that you've sent in a claim and it's still saying not enrolled in impact, or on their directory. So there are a couple different ways. The portal's probably the most straightforward. Okay, Eileen, I think you're talking about home health, and you're getting denials. If you want to go ahead and email me, please no PHI, the challenges and potentially is it one plan or what, sort of the background there. Why don't we try to take that offline and get you some, get addressed. All right, Lisa, you are getting denials even after you bill the primary and submit the denial. I assume that you'll be with the claim. Let's let's do the same and sort of understand what is what you're having going on there. John's asked a great question about getting the information sheet. It's my understanding that is mailed. That is a great question for HFS. Could you get that electronically? I will take that on. I'll see if there is a way for that to be sent electronically from HFS. Marilyn asked if occurrence code 55 is now being required on Medicaid and MCOs. I do believe we are, my recommendation on this would be to look into the billing guidance for your provider type. And if that on the comprehensive billing guide, if that does not address your question, go ahead and follow up with us with the general question. We'll do our best. Lisa, I believe I've given you my contact information. If you don't have it, it will be sent out in the email after that, but you can always, you don't even have to wait. You could go on the contact us website on our website and contact us. Somebody asked why we use the question box for these webinars. It is in part because we have 150 registrants and current attendees on the webinar. And so we want to make sure we can answer your questions to the best of our ability. You have an old, somebody, Mimi has an old admin on Impact. How do you add a new one? On that, I believe you're going to have to contact Impact on that to do that. And I believe you would use the registration contact, but I do think there's a way to remove an old admin and add a new one. I know that has come up before. We will be sending out the slides and the webinar recording. You will receive that. Kim, I apologize. I did not, your latest question, I just didn't understand. It's probably referencing back to something. Please go ahead and email me that. We do know that there are questions from providers asking how to associate to MCOs in Impact. That's not a functionality that is currently really operational. We do recognize that you can sort of check the boxes that you're in network with health plan A, B, or whatnot. But right now, that isn't really seen as the source of truth. And I don't think based off of what we see, you would want it to be as a provider. There's just such a large gap of providers potentially not updating that or not completing that piece. We would hate that for claims to be limited to how a provider was associated in Impact. So right now that is not an operational feature of Impact. It is something you can check, but it's not governing that. Somebody asked about the roster. So the roster is a mandate in state law. It is not something just from IHA or IMHIP. So if you are doing business in Illinois and want to serve the Medicaid members and want to be reimbursed by a Medicaid MCO, it is a state law requirement. I'm sorry if it sounded as though it was an IHA or an IMHIP thing. It is simply on IMHIP's website along with an FAQ for educational resources. But it is, you don't have to complete it because of IMHIP or IHA. It is a requirement because of state law. We got a question about developmental assessment. Again, we really just cover what is covered by fee for service. I do believe developmental assessments are a covered service, but there might be bundling and some other things there. If an MCO is not listed on impact and the MCO assignment do not impact, no pun intended, do not impact on being paid from that MCO. I do agree the LTSS benefit, that we got another question about LTSS member enrollment. It can be confusing how that looks on Medi. I think we're trying to work with HFS to help make it as clear as possible, but it is a challenge. And that, I believe, I've done my best to get through all of the questions I've received right at 1 o'clock. Please do feel free, if I didn't get to your question, do feel free to contact us via our website. I want to thank you for your time spending an hour with us. Do feel free to follow up on anything with IMHIP through our contact us feature on our website. And finally, one more reminder, you will receive the PowerPoint and the recording of today's webinar. Thank you all for joining us and have a wonderful Wednesday.